We're doing mental health first aid across the state of Missouri, and part of that is to create healthier environments in our communities to reduce stigma. And if we're doing that, we're creating an environment where, people will not be afraid to get treatment. They'll get treatment earlier. And if we're doing that, we're making homes safer for kids, which is the bottom line here. We know that in any given year, 1 in 4 adults will be diagnosed with a mental health disorder. We know the prevalence in a lifetime is 50%. So we know that if people are suffering from a mental health disorder, they're not likely to get treatment. They're not likely to get treatment on time. And if people are suffering from their own mental health issues, they don't have good patience when they're dealing with kids, because it's not easy to be a parent. It's not easy to be a grandparent. And if you need to be focusing on your own issues, you don't have time to give the kind of energy that kids need. And therefore, it becomes especially important that people are able to deal with their own mental health issues. And that doesn't happen. Stigma, people are embarrassed about having a mental health issue. They don't understand that mental health issues can be resolved, that recovery is possible. And mental health first aid teaches that. It helps people understand that. It encourages them not to be ashamed of that, but to understand that having a diagnosable mental illness is something that people can recover from. You need to be willing to go and get help for that, so that you can come back and be a good parent to your child, be a good grandparent to your grandchildren. And that's the bottom line here. We want people to be able to live good lives in their community, contribute to their communities, to be regular parts of their community, to have jobs and to live in their homes and to be part of their families and to, be parents and to be giving to their children. And that means they have to be good themselves. I've often thought that one of the first things that you need to do with child abuse is to teach parents to take care of themselves. And that means not just your physical self, but your mental self, because you can't separate. There is no health without good mental health, and that's what mental health first aid is all about. We're about ready to release a program that is specifically geared for people who work with children, and that would be very appropriate for foster parents, for people who work in schools. And once we get to that level, that's just a whole new level in terms of being able to directly impact, children. And we're excited about that. We expect to have that available this fall. So we're excited about, seeing programs come together and be really integrated, and mental health first aid is a good example of that.